Rin, just let us know when we're streaming.
All right, I'm clicking it now. You're live.
Great. Welcome, everyone. Good morning. And this is the Joint Committee on Audits and Evaluation. And we are joined today by our Director of the Office of Program Evaluation and Government Accountability, Mr. Mike Powell. And want to welcome all of our committee members to this hearing today. We have a busy agenda, so I think all of you have seen that. And let me take a moment to turn it over to our House Chair, Delegate Solomon.
Thanks, Senator. I just really wanted to say, looking forward to today's hearing. We always appreciate the work that OPECA does to kind of look under the hood a little bit at our government programs and state government and figure out what excited for today's hearing. And I also wanted to recognize we have a new House member who's with us today, Delegate Emily Shetty, who I'm somewhat partial to as my delegation mate in District 18. So we're really glad to have her expertise on the committee. So welcome, Delegate Shetty. And with that, I'm going to turn it over to Mike Powell and his team.
Thank you, co-chairs and committee members. For the record, my name is Mike Powell. I'm the Director of the Office of Program Evaluation and Government Accountability. And we haven't met with the committee for a year, so just a quick update. We have 3 agenda items today that represent 4 different reports that we've done. We also had 2 more earlier this year that we presented to standing committees during session, and we should publish 2 more before the end of this year. And I just want to acknowledge the staff of the office. I was down at a conference of my peers last week, and they cannot believe that an office of 6 people can put out 8 of these quality reports in 1 year. I can't promise you that we'll do 8 next year. In fact, I would bet against that, but I can promise you that we'll do our best to give you quality reports that let you know how the programs that you create and appropriate money for are performing. So with that, Eric, if you pull up the prescription drug disposal PowerPoint, we can get started. And let me start by sort of explaining what this is. So many of you have had the experience of, let's go back to that first one if you could. Checking your medicine cabinet and finding that you have leftover prescriptions from maybe a surgery or an illness, and you'd want to get rid of them. You don't want to put them into the sewage system. You may not want to bury them in the backyard. And some of you may know that some, but not all pharmacies will take those back. Me personally, I'll take them to the Baltimore County Police Precinct where they will take them. But this is an interesting report or evaluation that we did because collecting and disposing of unused prescription drugs is not anything that's mentioned in the law. There's no budget for it, and nobody's responsible for it, even though at least 5 different agencies are involved with it. So we'll tell you a little bit today about what we learned about this effort that the state makes. Eric, you can go to the second slide, and I'm going to hand it over to Allison Binder from our office, who will walk you through the rest of this. Oh, Allie, before you go, I also want to point out that some folks from the health department are here today and I think are prepared to give some remarks. And we also have some people from the state police who are available for any questions that the committee might have. With that, Allie.
Good morning. So as Mike mentioned, we do not have an organization or agency of the state that is responsible for this. But what we did identify during our evaluation are the 5 units or entities of state government that are involved in prescription drug disposal. So you see them here. So the Board of Pharmacy, the Department of Health, State Police, the Department of the Environment, and 211. Maryland. So the Board of Pharmacy, to start with, unsurprisingly participates in this activity. What they do is they approve and regulate drug repository pharmacies. So pharmacies will apply to be a recipient site of pharmaceuticals, and the Board of Pharmacy oversees that practice and maintains a list for public access. The Department of Health does a lot of work with local grant funding. They disseminate disposal kits to the general public, as well as other organizations in the state. And they do provide a lot of information both in person and on their website. Can move to the next slide, please. Thanks. So the state police have provided us some great data here to look at the amount of prescription drug material that they're receiving over time. And some of the other things they do in addition to recording this information is that each of the state police barracks throughout the state has 24/7 access to prescription disposal containers. So folks can just roll up to the barracks and dispose of medications, unused or unwanted medications. It's anonymous and there's no fee or charge for this service. The state police also, as you can see here, they handle state police drug take back events. So these will be open to the public to be able to, as Mike mentioned, grab that stuff out of your medicine cabinet and return it safely to a location. They do this generally in conjunction with federal initiatives for drug take back and safety. As you can see here, the top graph is the Maryland State Police Medical Disposal Program weight log. So this is the amount of material that the state police are collecting, and the captain can speak more to this, but it's what they're measuring and weighing as they dispose of this material. There's been a bit of a decrease there, as you see, as well as in the amount of material that is received at the drug take back events. Obviously, there's 2020 canceled some. We can't say for sure and didn't determine during our evaluation the exact cause of these fluctuations in the amounts. But there are things that go on, such as the disposal is not necessarily just prescription or unwanted or unused prescription medication. The state police will dispose of that along with other evidence or seized materials that need to be disposed of. You can move on to the next slide, please. So the Department of Environment, as we mentioned, is a participant in this process of disposing drugs across the state. It's mostly an information provider. So they publish information, as you see on the screen here, like guidance for safety or safe drug disposal within household trash. So the main focus of the Department of Environment in terms of drug disposal, as well as just the information that they're publishing on their website, is environmental. They want to prevent the contamination of the sewer water, as well as groundwater contamination that can occur from improperly disposed of medications. But they are a participant in this area in our state. Next slide, please. So the state contracts with a nonprofit entity to run 211, as everyone probably knows. But for our purposes, we see that 211 does list prescription drug disposal as one of the things it can help the public with. So they offer information via text message and phone call. As you can see on the screen, OPEGA did take the opportunity to try and get some disposal information, specifically a drug disposal bag from 211 that was not successful. But we did attempt. And then also OPEGA made a phone call to 211 where the information was not readily available to the operator, but the operator did take the time on their own to go get that information for us and then called us back a little while later. Next slide, please. So a big focus of our evaluation was looking at the information provided to the public from each of the identified organizations involved. What we did find was that it's not entirely consistent across organizations. So for example, one of these agencies may publish pharmacy location information where you can dispose of medications. Others might not include pharmacies on their list. Some may include state police barracks as a location for disposal, and other sites may not publish that same information. Next slide, please. So in addition to what Maryland does, in terms of getting rid of prescription drugs. We also looked at what some other states do or what these models are beginning to look like across the country. So we identified product stewardship models as sort of what's beginning to take root across the country. There are 8 states at the moment who have official product stewardship models. What that looks like for people who might not be familiar, it's just the taking of responsibility for the environmental or social impacts of a product from design and development all the way past end user receipt of the product. So heading to the disposal. We then get rid of ourselves. Product stewardship has the developers and the manufacturers taking some responsibility in the area of disposal. So these things differ across jurisdictions just a bit, but in general, they include the provision of disposal collection sites, the administration of mail-back programs for unused or unwanted medications. They will occasionally, in some instances, have manufacturers funding the operating expenses for what are usually private operators in the state. And in some examples, they're also managing these drug disposal programs and contracting with the private agencies that perform them. So we looked at 4 specific examples in our report. The first was Illinois, which established drug take-back locations that are funded and managed by manufacturers operating in the state. These things are free of charge for the public. In Washington State, the Department of Health develops and oversees these statewide disposal programs, but it's entirely funded by pharmaceutical manufacturers operating in the state. That includes, in the case of Washington, the expenses incurred by the Department of Health for this purpose, even though the program operators that are being funded are private. Oregon's model is very similar to Washington, but the program operators are overseen by the Department of Environmental Control as opposed to the Department of Health. The 4th example we included in our report is New York State, where manufacturers have been required to establish, fund, and manage a state-approved product stewardship model for pharmaceuticals in the state. And that is about the summary of our report.
Yeah, thanks, Allie. I'll just wrap up by pointing out that, one of the things what we wanted to do but weren't able to do was figure out what is the cost to the state of Maryland to do this, because obviously there is a cost. It's difficult to say. Again, nobody budgets. There's no line items in the budget for doing this. And some of it, and the state police can speak to this, but like they are making trips to dispose of other materials anyway. And so doing this is like, there is an additional cost, but how much is that? It's difficult to say. But as Allie pointed out, there are some states that have pharmaceutical manufacturers that fund this. And we wanted to include that in the report just so you were aware. We did not have any recommendations in the report. And that concludes our presentation, but we are available to take questions.
All right, I see a question from Senator Kagan. If anyone else has a question, feel free to raise your virtual hand and we'll call you in the order that we see you.
Thank you, Mr. Chair. Appreciate it. Allison, I had a quick question. You talked about state police barracks being a drop-off. I wonder whether there is a partnership with the county police or municipal police around the state. Is it any police department where they could accept drop-off drugs?
Let me take that, Senator, if you don't mind. So every state police barracks, you can drop stuff off there 24/7. In my county, Baltimore County, all the police precincts participate, but that's not the case in every jurisdiction in the state. So some of them will do that. Not all of them do.
Okay. And then the follow-up question was where there are drugs that are collected at the local level, is that weight and the number of prescriptions, the amount of stuff that's dropped off, added to the state's total to accurately reflect the turn back?
It's not. So the state police, correct me if I'm wrong, but like Baltimore County is not reporting to the state police the weight of the drugs that they collect and dispose of themselves. And the whole reason this state police take that really seriously is they need to make sure when they put 100 pounds worth of prescription medication, opioids in some case, and then they take it to the dump or to Bresco or an incineration facility, that like 100 pounds of it shows up there. And so they're very diligent about keeping those records.
Okay.
All right, thank you. Next, I see Senator Benson. Go ahead.
Yes, thank you very much. For the drugs that are collected, uh, where do they go? Are they just disposed, or how does that work? Could you tell me how it works?
Baltimore City has an incineration facility where some of this stuff ends up, the stuff in the Baltimore region. I know in some of the more rural areas of the state, they'll take them to like funeral homes and crematoriums to incinerate them there. I believe some of it is also safely buried in landfills. It's not like when you go to the transfer station and just throw it over the side, like they make sure that that stuff is handled appropriately. Again, I think all these questions are sort of maybe making the main point of our report, which is that nobody is in charge of this effort. It's not even, in fact, anyone's responsibility officially in the state of Maryland. And so what you see is this sort of fragmented effort where, again, a bunch of agencies are doing things, locals are doing anything, but nobody coordinates it. So nobody knows the total amount of this stuff that's collected and disposed of in the state. As Ali pointed out, information differs depending on which site you happen to go to. So it's not coordinated. Again, it's nobody's responsibility to coordinate this. And it's not to say it's not working well. It's just difficult to answer some of these questions really accurately because, again, not an official function of state government.
In my district, we have a lot of people who are low income, and they have real issues with getting prescriptive medicines. And so I'm just a little concerned that they are absolutely disposed of. There's no way that you all don't have an agency or anyone who can take a look at the possibility of using some of these drugs for persons who are low income. Well, they could come and and working with the doctors.
Yeah.
I mean, that sounds like pie in the sky.
Yeah, no, Senator, I think there is a very limited repository program that hospitals may participate in, or possibly pharmacies that are based at hospitals where they are able to take some of this stuff that's unused or maybe not sold. Maybe they overorder something that they need and be able to contribute that. But that's something the health department may be able to speak to better than I can. But your point is, I think, accurate, which is that there is not a sort of robust program for taking this stuff that somebody else, especially low-income person, might be able to use and getting that to them.
Oh, okay.
Yes,
Thank you. Thank you very much.
Thank you, Senator Benson. Next, I see Senator Hester.
Hey there, can you hear me?
Yes,
Yeah,
ma'am.
go ahead.
Fabulous. So our committee has seen a couple of different bills on extended producer responsibility. One of them, the needs assessment is coming out either in January or December, I forget which. The other one was specifically on paint stewardship. So my question is about these 8 states that offer extended producer responsibility for these drugs at the end of their useful life. In those states, do we have, or could you provide offline any an evaluation of the effectiveness? Like in conversations with the states, are they saying that there's more material being recycled than there was before? And when you said that there was sometimes the manufacturers were like footing the bill, I mean, oftentimes that they then bake in the cost for the end user. So I'd also be curious kind of what the, if it's truly free to the state, or whether the costs are being passed along.
They're great questions, and that is something that we may want to follow up with you afterwards. Most of those stewardship model programs are very new, and so I'm not sure the amount of data that they have available. But it's a good question. Like, was Washington State measuring how much they collected prior to the stewardship model? And now that they're doing that, has it increased the amount that they're collecting? It's a good question. We were mostly focused on what we do in the state of Maryland. But we can look into that and get back to you, Senator.
That would be awesome.
And Senator, I was just going to say, I actually had worked on a producer responsibility bill, so I'm happy to follow up with you offline. I think one of the biggest things that we found was we have a lot of options in the state. I think to Mike's point, they're just not coordinated. And then obviously the only entity that's sort of not responsible for any costs in this is the pharmaceutical industry. Every other player, like the pharmacies, are actually paying for a lot of these drop boxes. So would be happy to talk with you more about that.
Thanks. If I could also just park a question for MDE whenever they come in. If we are truly sending these for disposal at crematoriums, that scares me, because my understanding is that we kind of calculate those based on weight in versus weight out, and we're not actually measuring the actual emissions from our crematoriums. So I heard that, and that just raised a red flag for me. So if MD could respond to my office offline, that'd be great too. Thanks.
And Senator, I'll pass that on. Because their role in this is so limited, I didn't ask them to be here today. That's on me. But I'm happy to follow up with them, and I'm sure they'd be happy to get in touch with you.
Okay, thanks so much.
Yep.
All right. Next, I see we have a hand raised from Dr. Cal Yanaraman, our Deputy Secretary. Go ahead. I think we can't hear you if you're speaking.
Looks like you're unmuted, but you might be having audio issues.
Can you hear me now?
Yep.
Yes.
Now we can hear you. Go ahead.
Okay. Sorry about that. So yes, this is Dr. Kiliana. I'm the Deputy Secretary of Public Health for the Maryland Department of Health. I just wanted to take a moment to respond to Senator Benson's question about the medications and whether they can be used for other patients, and she mentioned particularly low-income patients. Quite separate from any of these drug take-backs, that's we've had this question in a variety of formats, and it's actually really logistically, I would say, almost impossible to be able to repurpose medications from one patient to another, mainly to make sure that the medications are safe, that they haven't been stored improperly, adulterated, or anything like that. So even for things like blood pressure or diabetes medications, we don't do that. So I don't think that's a viable option, particularly for the kinds of medications we're talking about here.
Thank you for that.
To the MDH folks, I know you had a couple of slides. If you want to pull them up, feel free to get started.
Happy to do so. So once again, thank you for having us, and thank you to Mr. Powell as well, and Opega. I am here on behalf of the department, representing both Public Health Services and Behavioral Health Administration, because both of those pieces of the department oversee parts of prescription drug disposal. Within Public Health Services, we have our Office of Controlled Substances Administration, which oversees and enforces the Maryland Controlled Dangerous Substances Act, and enforces the controlled dangerous substances availability of drugs for legitimate medical and scientific purposes. OCSA also issues CDS permits to practitioners, researchers, establishments that administer, prescribe, dispense, distribute, manufacture, or conduct research or chemical analysis of controlled drugs and substances. In the context that we're talking about in terms of prescription drug disposal, OCSA addresses disposal of controlled substances by CDS registrants, not by patients. And so those are so this is really on the provider side of things. So CDS registrants who are looking to dispose of controlled substances should return those to their original supplier when possible. And if that return is not possible, it should be sent to a DEA licensed reverse distributor. CDS registrants that are licensed to administer only, like in assisted living facilities or long-term care centers, can destroy controlled substances that are no longer needed by their patients with 2 witnesses and reporting it to OCSA within 10 days of destruction. And then if none of these are possible, they can contact OCSA to have an inspector visit to do a witness destruction of controlled drugs and substances. And the purpose of this is to make sure that on the provider side, there's monitoring and oversight to make sure there's no diversion of those products. Along with that, OCSA publishes and shares information regarding opportunities for Marylanders, and I think our Mike and others talked about this, but federal and community take-back programs, safe disposal kiosks, particularly at Walgreens, is notable in terms of the extent of their offering that service. And of course, as noted, these medications can be mixed with undesirable substances or even in flushing them in certain situations, particularly for controlled substances. Next slide, please. Within the Behavioral Health Administration, there are a couple of programs that address this, the Opioid Misuse Prevention Program, and with OMPP funding, local jurisdictions implement evidence-based primary prevention and intervention strategies to prevent and reduce opioid misuse, overdoses, and overdose fatalities. And these strategies are targeted to the general population or to those who are in increased risk of misusing opioids or already misusing opioids. And so you see the distinction there between the providers and the public in terms of how we are organized here in the Maryland Department of Health. And in addition to the safe storage and disposal activities, there are other strategies that OMPP funds, including prevention education, overdose education, naloxone training and distribution, and education for prescribers and pharmacists. And so you can see here some of the safe storage and disposal activities that are actively being implemented by jurisdictions. So drug take-back events, homebound pickups for prescription drugs, Deterra bags, which are bags that contain a compound to inactivate these medications, educational materials and resources, social media education, and then collaboration with law enforcement to promote services and offer Narcan trainings. And so there's a range of activities that NDH oversees here as part of our piece of this landscape. And so with that, I'm happy to take any questions.
Anybody's got any questions? Feel free to raise your hand. I had just a couple. Dr. Kalyanaraman, thank you for your presentation. The first question I've got for you, and I don't know if you can answer this because I guess it's more to the Board of Pharmacists, but obviously that falls under MDH. Is there any way that we could potentially update the standards for prescription labels in the state to put something on there about, you know, a link to a website or a link to a take-back program or something where people could sort of see, you know, I can go here and figure out, you know, how I properly dispose of this?
So I'd be happy to take that back to the Board of Pharmacy and see what their thoughts are on that.
Great. And I guess the other question I have, and I'd be curious your opinion on this. So, you know, as I mentioned, we had explored doing the sort of producer responsibility piece, and it seems like, you know, and again, I think the Opega report bears this out, that we actually have quite a number of options. And again, I'm just really appreciative of Mike and Alice's work and the whole team, because even the process of doing this report, you know, it was interesting that the pharmacy's website was then, the pharmacy board's website was updated to reflect that we've got, you know, something like 240 sites that actually do take this back, of just pharmacies themselves. You know, we've got the MSP, we've got so many different options. It just feels like, and I had several robust conversations with the pharmaceutical industry about this, that we have a lot of options. They're just sort of scattered. They're not prominently listed on websites anywhere. They're sort of hard to find. So it would seem to me the sort of two big pieces that I see that we don't have is maybe like one sort of central coordinator, whether it's at MDH or the Board of Pharmacies, who's sort of responsible for, making sure that all of these actions are working in concert with one another. And then obviously we don't really have, I think, a robust enough public outreach program. And again, as I mentioned, the only part of the equation here that doesn't seem to be spending any money is the pharmaceutical industry. So just be curious your thoughts on that, whether you do think we need sort of more of a concerted effort to publicize this information and get it out to folks throughout the state.
Mm-hmm.
Yeah, so to that, I believe that we can can coordinate better in terms of our communications. I certainly noted the different information on websites, and I think this is an opportunity for this report for the principals to share information amongst themselves, so that we can get that out better, and also determine how we're getting information out to the general public as well, not just available by website, but how we're actively sharing that.
Great, thank you very much. Anyone else from the committee have any questions? Captain Barnes, anything you want to add? You don't have to. Just wanted to make sure you got an opportunity to speak if you had anything.
Good morning, sir. Thank you for the opportunity. However, I have nothing to add at this point.
Thanks. Thank you for being here. All right. Well, seeing no further questions, thank you to everybody from MDH and MSP that was here today. And I think we are going to turn it back over to Mike and the team for the Neighborhood Business Works.
Sure. And Eric, if you would pull that PowerPoint up. And is Diana Winter from my office on this call?
I am here. Verizon.
Oh, great. She's been threatened with an internet outage. So if we lose her, I think I'm capable of doing this by myself. But let me introduce this. So we were asked to do an evaluation of a small business loan program out of the Department of Housing and Community Development. It's called Neighborhood Business Works. And Neighborhood Business Works was started in the 90s in the Glendenning administration as sort of a smart growth initiative. And the idea behind this was to incentivize businesses to start up, locate, and grow in existing pieces of property in designated areas. And they were usually like densely populated areas, like you think of sort of Main Street type areas. And as far as smart growth, the idea was that you didn't need to turn more farmland, forest, et cetera, into a new shopping center when you could sort of repurpose an underutilized building and turn it into a mixed-use development or a brewery or a restaurant or a bike repair shop or like any number of different things. And so we essentially just wanted to see how that program was working, if the financial return was there, but also if the community impacts were there as well. So if we go to the second slide, I'm going to turn it over to Diana Winter from my office to walk through the rest of this.
Thanks, Mike. So just to start off, I wanted to point out that Neighborhood Business Works is one of many small business financing programs available in the state. A lot of them are offered through the Department of Commerce. There are also some at the Maryland Technology Development Corporation. And then we have Neighborhood Business Works. So there are a lot of options for businesses to go to when they're seeking financing. Next slide, please. So Mike talked a little bit about how this program started. Since 2004, so between 2004 and 2019, the General Assembly passed multiple pieces of legislation that actually expanded the program into other regions of the state. So in 2016, the General Assembly passed legislation expanding NBW eligibility to small businesses in priority funding areas. It also allowed DHCD to act as a primary lender. So historically, DHCD could only provide gap financing or act as a secondary lender to another lender. And in 2016, they were now allowed to act as a primary lender. That legislation also authorized DHCD to issue bonds to raise capital for NBW lending. And then in 2019, the General Assembly further expanded eligibility to projects in specified opportunity zones across the state. Next slide, please. Great. So the Neighborhood Business Development Fund covers the operating expenses of the NBW program, including financial assistance that DHCD provides to small businesses, nonprofits, and micro enterprises through their NBW grants and loans. State appropriations to the fund are usually made through the capital budget process, and the fund represented around 5% of DHCD's capital budget appropriation during the fiscal years that we looked at. As shown on the slide, the appropriation has actually grown in recent years, and in fiscal 2023, DHCD was also awarded federal funds for the NBW program through the State Small Business Credit Initiative. I checked the numbers this morning, and in fiscal 2024, the state appropriation is around the same amount as it has been in the past. It's $22.2 million for fiscal 2024. Next slide. All right, so this is just showing kind of the diverse range of projects that NBW loans are funding. There is definitely a particular emphasis on commercial and mixed use projects in downtown areas, but I just wanted to highlight a few of them. So we have a brew pub in a former church in Baltimore. I'm sure some of you have been there. Relocation to a family-owned funeral home in Frederick. There's a music venue in Cecil County that got a business loan, and we have several mixed-use developments, one here highlighted in Charles County. So really just a wide range of projects that are receiving funding through this program. Next slide, please. Okay, so when a business receives an NBW loan, what happens? So I'll start with what we can tell you. It looks like the state isn't losing any money on these loans, which is good. NBW borrowers generally repay more than what they owe every month, and an average of around 94% of borrowers ended up repaying their loans on time. You can see on this slide that between fiscal 2016 and 2021, actual repayments were higher than expected repayments every year, with the exception of 2020. In response to COVID-19, DHCD actually offered temporary deferment of monthly loan repayment to some of NBW's borrowers who were eligible. Relatedly, we learned that DHCD actively supports NBW borrowers when they struggle to make payments. So if they notice that there is a repayment issue, they'll act very quickly to provide technical support or even alterations to the loan agreement if it's necessary. We saw that business loans that enter delinquent status usually aren't there for very long. Most of them end up being back on track within a couple of months. And when we finished our report, there were about 15 borrowers with a combined balance of $1 million, a little over $1 million, who had defaulted on their loans. A lot of that has been repaid in full. One of the borrowers valued at they had a balance of about $600,000. We're actively repaying under a forbearance agreement, and around half of that has also been transferred to central collections. Next slide. So the community impact, which is really a big part of the NBW program, is a little harder to figure out. So DHCD staff are able to move forward with developing a loan package for higher risk borrowers when they think that the expected community benefits of a project outweigh the risk that the loan might not get repaid. However, DHCD's analysis of a project's expected benefit can be based on self-reported information from a borrower. We found that a lot of the data reported by DHCD around community impact, for example, the number of jobs that were created, is actually based on information provided by borrowers during the loan application process, and DHCD doesn't follow up to independently verify the impact of a project after the loan has been dispersed. to reference what's on the slide, DHCD also has chosen to require borrowers to submit an MBE agreement specifically for construction projects that receive at least $250,000 in funding. These borrowers are required to provide a monthly report of all of their vendor and subcontractor payments to DHCD's Office of Fair Practices. Of the awards made during the period we looked at from fiscal 2019 to 2023, 16 of the borrowers were required to submit an MBE plan and monthly reports under DHCD's policy. But as you can see on the slide, only one borrower actually submitted their monthly reports after receiving a loan. Next slide. So through our evaluation, we also identified some components of the NBW lending process that might expose the state to additional risk. The first piece is the direct authority of the DHCD secretary over the program. It's possible that that authority may undermine some of the controls built into the lending process. So according to DHCD staff, the loans are only recommended for approval if an underwriter and the NBW director agree that they are fiscally responsible and that they meet the mission of the program. However, DHCD staff familiar with business lending shared that the secretary is able to bring projects to staff members and direct them to work with potential borrowers to develop an application. In regards to one of these projects, a staff member wrote, quote, "I know the secretary is keen to proceed and it is therefore a done deal." So the second thing we wanted to highlight is that between 2018 and 2021, every loan presented to DHCD's loan approval committee or the secretary was actually approved. So the staff kind of approached the committee and secretary review as an opportunity to fine-tune the lending terms, but not necessarily as an opportunity to challenge the recommendation to provide the loan in the first place. The last thing we wanted to point out with the lending procedures is that DHCD doesn't really have any information systems that speak across the different departments that work with NBW. So there's really a lot of information being collected by different offices that's not speaking to one another, and things can go missing in the process. Next slide. All right, well, our evaluation did focus mostly on the business lending component of Neighborhood Business Works. There were a couple of other findings related to programs within the Neighborhood Business Works umbrella that we wanted to touch on. So the first one is that statute requires DHCD to make a reasonable, good faith effort to allocate 25% of NBW grants and loans to micro enterprises. We noticed that DHCD didn't achieve this goal between fiscal 2012 and 2021, and in fiscal 2014, 2015, and 2021, they didn't provide any grants or loans to the microenterprise loan program. The office doesn't necessarily have the technical capacity and the resources to support borrowers who would be applying through this program. So they work with intermediary lenders to give out these loans. And we also noticed that there are no intermediary lenders serving micro enterprises in Allegheny, Carroll, Cecil, Garrett, and Washington counties, which means that a lot of those businesses might be missing out. The second thing we wanted to touch on is that within the NBW program, there's the Fresh Food Financing Initiative, which was established by the General Assembly in 2014. The initiative provides up to $100,000 in financing to help create and retain small businesses and other food-related enterprises in designated food desert areas. Local governments have to apply for that designation, and as of 2023 in January, no government had applied for it to DHCD. Next slide. All right, to wrap up, we did have a series of recommendations, some of them for DHCD and some of them for the General Assembly. So for DHCD, we recommend that they consider collecting more robust information about the community and economic impacts of borrowers. We also recommended that they invest in a management information system to be able to track a little bit more about what's going on with NBW loans and grants. And lastly, we recommended that they conduct an independent audit of their lending practices to identify potential risk factors and update their policies. Next slide.
And for the General Assembly, we recommend that you consider clarifying the objectives of the program just to better define the economic and community impacts that you want NBW to be prioritizing. And secondly, just to update statute to align with the current structure of the program. And that is it. I think we'd be happy to take questions.
Sure, we are available for questions, and I know a couple folks from DHCD are here, possibly including Secretary Day.
All right, thank you. Let me kick it off with a question. I see we have some hands raised, and if anyone else wants to ask questions, feel free to raise your virtual hand as well. Thank you for that presentation. I'm curious about the quote that you referenced during your presentation that the secretary weighed into some project that essentially was communicated as a done deal. Can you shed a little bit more light on that project and what the context of that was?
Yeah, I'll take this, Diana. And I do want to be clear, this was the previous secretary. This is the previous administration when we were in the field doing this work. So I don't want it to reflect on the current leadership at the department. So there's a loan there that quote's related to that caught our attention as we were sort of doing data collection and analysis. And it caught our attention for maybe 3 reasons. The first is that there was no underwriting documentation for that loan. And if you look at some of these loans, take the one in Cecil County that Diana referred to before. This is my recollection is it's a couple who wanted to take an old auto shop, mechanic shop, and turn it into a live music venue in Cecil County. So they borrow however many hundreds of thousands of dollars from the state to be able to do that. And the amount of underwriting is voluminous for all of these loans. Like it's every bit of money that a person has and all their different accounts, what their pension's worth, like all these sort of things. And then there are like architectural and engineering plans for what they're going to do with the building with quotes from contractors on how much it's going to, all of this stuff. It's very, very thorough. Except in this one, there wasn't anything. And then the second, and I asked the department, you know, is it in a different folder that we didn't get? And they were never able to provide me any of that documentation. The second reason it caught our attention was that the terms and conditions of repaying this loan were different than other loans we had looked at. And one of those differences was that except for under certain circumstances, they may not need to begin repaying that loan for 15 years. And then the last thing that caught our attention was that the loan just looked different. So most of these, you get an idea of what they are. They're in sort of these dense sort of commercial areas. This one happened to be in an industrial park off a highway, also coincidentally in Cecil County. And it was not for sort of the commercial retail businesses that many of these are, but was instead for a biopharmaceutical company. And we did sort of press pause on this evaluation and just wanted to go into depth and make sure we didn't miss anything on this particular loan. And that includes asking for emails related to that loan. I'll point out that the initial loan, I think, was $500,000, but since then, this company has received, I think, $8.5 million from the state of Maryland. At the time we were making those investments, this company, which is publicly traded, was trading at about $20 a share. Recently, it's about $1 a share. DHCD went into depth in their response to our report, which you can all see online. And I want to be really clear. We looked at this very thoroughly and didn't see anything that looked illegal or even inappropriate about it. But I went back and forth on whether we even talked about it in the report or not. And at the end of the day, I figured that due to those 3 reasons I mentioned before, that the General Assembly, it's reasonable to let you know how capital money that you appropriate was being spent. So that's why we included it. Senator, to your specific question about the secretary, they brought this opportunity to the Neighborhood Business Works program. I believe they created an alternate structure to be able to approve this loan. And again, I think they're happy to discussed this, my understanding was that they were looking for an opportunity to create a bond and issue that bond. And I'm sorry, I'm not a banker or a financier, so my terminology might not be great. And I think they were looking for a loan like this that gave Maryland an equity investment in a company that had the potential for some big growth as part of that bond that they wanted to issue. Ultimately, they didn't issue that bond, and I think the pandemic may have been a part of the reason why that didn't happen. We were very thorough in looking at that. We've talked about it with the HCD at length. Again, they addressed it thoroughly in their response, and I don't have an issue or argument with anything that they said.
So let me just ask a follow-up then. So with regards to this biopharmaceutical firm in Cecil County that you were referencing, you said that you didn't find anything illegal, nor, quote unquote, inappropriate. But it sounds like there was no information about how the secretary happened to find out about this project and why he weighed in specifically on this project. It seems like, based on our research, that this happened to be a site that Governor Hogan had visited, and the biopharmaceutical firm had no lobbyist that was working on this, but the developer did. And so it just seems very curious set of circumstances here that led to this loan that started as $500,000 that ballooned to $8.5 million. Was treated very differently than some of the other loans that the department had designated and provided out.
Again, the lack of underwriting certainly caught our attention, especially given how robust the underwriting is on some smaller loans and some potentially less risky loans.
Okay. Well, I guess the department was fully cooperative in offering documents that you had asked for about this?
Very transparent.
And you couldn't find any connection why this loan was handled differently than some of the other ones?
I could not.
Okay. I think next we had Delegate Blackridge-Carr. Go ahead. You had a question?
Thank you, Chair Lamb. Thank you for the presentation. I'm two questions. One, I'm curious if, as part of this evaluation, there was any information collected about how businesses are finding out about the program or coming in the door to the program. I feel like overall, with serving on the Ways and Means Committee, more familiar with the programs administered by Commerce, but often this is an issue in terms of, especially small businesses are just not aware of the programs that are out there. So I wondered if that was part of the scope of this, if you can speak to that, Ms. Winter.
Sure. If you don't mind, Delegate, if I try and take that first, and Diana might correct me if I'm wrong. That occurred to us too. And we see this in a lot of different programs and loans around the state where it's like, if you just don't know about that opportunity, like for some reason you're out of luck. We did talk to DHCD about this, and they said, part of what they do, and I know Mike Kolosky's here and might be able to speak to this, but they go to a bunch of these small business events and conferences, and like they are sort of out there. They also work, I think, closely with the county economic development offices. So in a lot of cases, some of these borrowers are also getting money from their county as well. So I don't know how to measure that, but certainly in talking to them, like marketing this loan program is an important part of what they do.
Thank you for that. And if I can ask one follow-up, I'm curious for then businesses that are seeking to participate in the program, is there any kind of like warm handoff to other business development entities you mentioned, like on the local side or to the Department of Commerce or say TEDCO, if there were other programs that the businesses might be able to participate?
Yeah, I mean, it is a very sort of person-to-person process over at DHCD. And I think there's a lot of picking up the phone and calling somebody in a county or maybe somebody they know at a bank, because most of these are sort of secondary to a private loan that the business might get. So it is a very, I would say, personal business.
Senator Kagan, go ahead.
Thank you, Chair Solomon. I have a number of questions, and Delegate Pavlovich-Carr and Senator Lamb asked some of them. I want to go a little deeper, Diana. Some of these are small questions, but some. First off, your very first slide had FY21 as the most recent, and I'm wondering why we have no data from recent years. That's a quick question. I'm curious about interest rates and whether they're market or reduced. I'm curious also, you talked about grants and loans. I'm wondering what the differences are, and who gets which, and specifically small businesses, roughly what percentage of the program of the allocations are made to nonprofits in terms of, therefore, grants versus loans in terms of repayment and all that. So I know that's a million questions, and we can also go deeper another time. But if you could answer the crux of that, that would be great. And it's great to see both Secretary Day and Deputy Secretary Glanz on this, so they may have the ability to answer some of this as well.
Yeah, Diana, go for it. And if you want me to jump in, I'm happy
to your first question about why we only have data up to fiscal 2021 is because we started this report in fiscal 2022. And then yeah. So I can get you updated numbers if that would be helpful. But I think we published this report finally in February, but while Mike meant to come through. So those numbers are just based on when we wrote the report. Your second question about grants and loans. So actually, I think your second question was about interest rates. So they do actually provide lower interest rates. The development aspect of it is if a business can demonstrate that they have a community impact, then the state is willing to take on a little additional risk in terms of the interest rate, in terms of the payment timeline, in terms of quite a bit, actually. They have a lot of flexibility about how those loans are structured. And so you can see a lot of them have better interest rates than they might have gotten on the market. In terms of the grants and loans, most of the things would be you helped out with the Ellicott City flooding and helping rebuild with that. There was some rebuilding in Baltimore that happened. And I'm sure they can speak to other times that they've actually facilitated a lot of grants. But for the most part, those were in emergency response situations. And it's a little bit more detailed in the report. In terms of the breakdown of how much went to nonprofits and how much went to other things, I'll have to get back to you on that because I know we didn't quite put that in the report, but I can try and run the numbers and send it to you.
And I think the committee might be interested in seeing any changes in practices, procedures, or outcomes based on a different administration. And I echo Senator Lamb's concern about transparency and process. And so, new day in the Moore Miller administration, what has Secretary Day and his team changed or not yet? Might be in the process of more transparency or a different process. So, thank you, Diana. Excellent retention of 19 different questions.
I taught in a classroom for 2 years, but I feel like it helped.
You're good. Thank you.
Senator Frey-Hester, go ahead.
Thank you, Mr. Chair. I think my question is for Secretary Day or anybody at DHCD who wants to take the question. But one of the recommendations was around the management, the IT management system for this particular loan fund, which begged for me the broader, DHCD gives out a lot of money. Aren't you guys? Don't you have like an integrated system for IT and if not, like, how does that impact you and what is your IT plan?
Senator, is it okay if I jump in here? Okay.
Please.
Sorry, I think there's a little delay on my end. I apologize for critical challenges that our team has encountered since coming into this job. Recognizing that the systems that we had in place, I think, were just frankly insufficient to adequately track across the underwriting. Excuse me. Let's start even earlier. Across the application, underwriting, and then financial management, finance, or small business lending. And so we immediately began about the work of acquiring that system. And so vendors been selected, ProLink. We are in the process of implementation, and it will take into 2025, all the way from application all the way to asset management for the life of any of our loans. So it was a necessary acquisition. It was a major systems acquisition, and implementation is underway.
Thank you very much. Just making sure.
Thanks,
Mike,
Dan.
I had one last question for your team, and then I'll turn it back over to the secretary for the DH. Senator Kagan and Delegate Carr got to actually a number of the questions that I had. So Dan, I appreciate your recall of all that as well. The one number that stuck out in my mind in looking through the report was some of the data that you all presented on Maryland's small businesses facing sort of financial hardships, and how that number was substantially higher in Maryland than it was looking at national averages. And I know that obviously can be for a myriad of different reasons beyond just the NBW program, but just curious if you all dug into that at all, as that we have in general.
Sure, Diana, you want
So
to
we
take that?
didn't dig into it too much. I think for context, the definition of a small business is actually pretty broad. I think like 99% of businesses in Maryland, don't take me on that number, but it's in the high 90s, are actually the range of what can be included in that is pretty extensive. So I would say that issue for a micro enterprise, which is a much smaller business, versus a generic small business, is going to be very different. And we'd have to look into that a little bit further, I think, across industries, across the location of the state, and that, and we'd be happy to pull anything that we looked at for you.
That'd be great. And just lastly, did you all dig a little bit more deeply into the micro enterprise, micro grant piece beyond just the fact that they haven't really been giving them out? I mean, I was exploring the website and exploring the process for it. And I mean, even for the Montgomery County micro grant lenders, it seems like you would have to sort of, I think if you were just looking at it from a small business perspective, you might feel like you were disqualified if you weren't a Latino business because they use the LADC, and then the EDCUS seemed to honestly more like a refugee resettlement organization, which they seem like they do wonderful work, but I explored the website for like half an hour, and it was hard for me to find anything related to any kind of micro grant. So again, if I'm a small business in Wheaton, or I'm a small business in Rockville, or micro enterprise, I'm not thinking of applying to either of those. So I was just curious what you were able to find on that piece of it.
Mike, you want me to take this one?
Please.
All right. So we didn't dig too much into it because it wasn't within the scope of the report. We were mostly looking at business lending. I will say that the way that program, mostly nonprofit intermediary lenders, will apply for a loan themselves, and they will describe who they target, what sort of business support, technical support, application support they might be providing to their recipients. We don't actually have a lot of information on who those recipients end up being, just because we didn't dig into it too deeply. But it is something that those firms actually have to reach out to DHCD and apply for the funds themselves. So DHCD doesn't go out and select like, hi, we want people in every single county. It's very much based on who comes to them for the funds.
Okay, great. Well, thank
I
you
have
very
one,
much.
I know,
So
just
with
have
that,
a follow-up
go ahead,
question
Senator.
to Mr. Powell. Just wanted to kind of press on this a little bit more. So, I guess with regards to the biopharmaceutical company that you referenced in Exhibit 21 on page 30, you had said earlier, let me just try to get this straight. You said earlier that the documentation there was much lighter than some of the other documentation provided for loans that have been granted to other recipients. And it sounds like the underwriting was quite sparse. Also mentioned that with regards to the program generally, that some of this requires like a personal touch on things that oftentimes are just calls that are made around, and the program kind of just moves along with that and awards these grants to different recipients. There's also the context that, in some of these emails you cite that things are just kind of a done deal, that, because the secretary weighed in on them and the committee just rubber stamps things. When it comes to projects like this, it just seems concerning that, it could be a call from the secretary or a call from the governor simply because the governor toured a location or a site that leads to a grant being provided out. And, it touches on what Senator Kagan was saying too, just kind of the transparency and process that's, maybe a little bit loose here. That you can have something with no documentation, very little oversight, requiring personal touches, and it really opens it up to potentially something inappropriate untowards happening if there's not proper guardrails. I question why you feel like there's nothing inappropriate here with this loan specifically, if it seems like the context of all of this points in a very different direction.
Yeah, I would just say when I say inappropriate, I think I mean they did not violate any of their like internal processes and procedures for doing these things. In some cases, they may have created new ones, but they have the latitude to do that. I mean, the point you make is the reason we included that information in this report, and it's why we have the recommend review and approval process to see if there's are other controls that could be put in place. Senator Kagan remembers a couple of years ago, and others do too, when we looked at emergency procurements, and I was to do an emergency procurement. And at the end of the day, it turns out that Secretary Day, well, at least in the past, that a secretary and their CFO who works for them could just decide to spend essentially an unlimited amount of state money. And the only sort of accountability and oversight of that was that 45 days later, they needed to report it to the BPW. And by that point, the money's gone, right? This is not dissimilar to that, at the end of the day, secretaries have the latitude, or at least had the latitude, to determine they wanted to do a particular kind of loan, and could make that happen. I don't know if that's a good thing or a bad thing, but it's the reason we wrote about it, and it's the reason that we made a recommendation that they look at how they might tighten up the controls to make sure that something inappropriate doesn't happen.
Mike, but
Well,
Mr.
I mean,
Chairman, I just want
seems
to,
like
I just want to give you the credit. Mike, thank you for the shout out, but it was Chair Lamb on the testing, the COVID testing kits that were flawed, that then Governor Hogan was procuring, that did later on in that instance. I'm sorry, Mr. Chair.
Yeah, no,
Just
thank
wanted to
you.
give you the credit.
Thank you. I mean, I think on this, it just seems like it really could, you point out emergency procurements, for example, and how this is very similar to emergency procurements. There were a lot of problems with emergency procurements, as Senator Kagan just pointed out, and we actually had to put better guardrails in place on emergency procurements because of, the lack of oversight and how some of the processes just weren't tight enough to ensure that there wasn't anything inappropriate going. And this really makes this seem like it's just another slush fund that, someone who might want to buy 17 times, a $500,000 award became an $8.5 million award. Seems like, something ought to be done to provide better guardrails and oversight over this process.
I completely agree.
Okay, any other questions from folks? All right, if not, I think we can move on to Secretary Day in the department.
Good morning. Can you hear me okay?
Yep.
Yep.
Right. Chair Lamb, Chair Solomon, thank you, members. And I want to say thank you for, first of all, to the Office of Program Evaluation Government Accountability staff for their collaboration and recommendations. I think before I get into some of the remarks that I wanted to share with you, I think I'll just jump right into the conversation we're having, if that's okay with you. I don't believe that government ought to be in the business of one-offs. Good program design, and yes, at times flexible program design, but good program design sets the boundaries for quality decision making, and also creates a fair landscape for people to compete for limited resources. This is not a plug for a budgetary ask for additional resources, but there are limited resources. Our lending tools for small businesses are limited. Our operating dollars for small businesses in Main Street communities are limited, and so we've got to have a fair landscape for people to compete in. And so I think this is an incredibly reasonable conversation for us to be having in terms of the future of not only Neighborhood Business Works, but also the associated grant programs, which have operated under a couple of different names, and I'll get into that in a few minutes because it's relevant to some of the questions that were asked. But I want to note my support for this conversation, and I'll get into our kind of response to the 3 recommendations of the office, but this is germane to the recommendation of the independent audit and subsequent programmatic design improvements that we make thereafter. So just really appreciate the conversation that's being had here, and I think it does highlight some of the things that have troubled me in the last 18 to 20 months. So the improvements, the recommendations that were made, I think are all things that will help continue to improve DHCD's business lending practices. As you know, Neighborhood Business Works is an important tool for small business around the state. It does provide flexible terms and flexible capital, longer amortization periods, and below market rates for some of our small businesses. Now, it is a broadly available program, and I think part of the charge and question before us, and part of where I've been hoping to steer things, and you can see that through some of our recent grant rounds, is into layering and targeting with other efforts that the state is making to address past injustices and to address the economic growth in Main Street and core commercial corridors that have long been underinvested in and disinvested in. So the program has been expanding for the past few years, larger capital budget allocations, more programmatic tools, and then, of course, the State Small Business Credit Initiative, almost $200 million entrusted to the state through DHCD to Commerce and TEDCO. The program currently has in its pipeline 6 projects approved for $10.1 million that are in closing right now, 5 projects totaling $14.1 million in the underwriting stage, and 5 projects awaiting underwriting at $20.8 million. Last year, in FY24, NBW closed 23 projects for $13.9 million, leveraging $7.1 million in private investment. As I provided in my written testimony, DHCD agrees with and accepts all 3 of the office's recommendations. Number 1, I want to note that we will be collecting more robust information about community and economic impact. And this aligns not only with the governor's effort to measure the economic impact and the leverage for all economic development programs that the state has, but it also aligns with DHCD's very robust, as the staff I'm sure would would be happy to complain about a very robust effort to measure the impact of our programs and to hold ourselves accountable to those metrics. So we're going to have a lot more of that data to report on in the coming months. The first phase of that internal metric process launches this month, and we'll be launching additional phases as programs and systems like ProLink, the information system that I mentioned earlier, come online. Second recommendation that we agree with, and just referenced it again, is investing in a management information system for all of our assets and all of our loans, including our housing finance and business lending. And lastly, to conduct a thorough assessment of lending practices through an independent audit. This is something that we intend to pursue in the coming months. So at a high level, we will assess NBW operations using the following steps. Number one, reviewing and updating all program policies and procedures and ensuring that our website has the correct and appropriate information for better transparency. The end date that we have set for that work, which is already ongoing, is December 31, 2024, so end of the year. Once that's complete, DHCD will request our internal auditor to conduct a complete desk review to see what operational at the end of Q1 2020. We'll also be implementing, as I said, ProLink, this new software system, and that will streamline communication between all of our borrowers and applicants and the department with transparency for the supervisor and director, and ultimately myself and the General Assembly. It'll also enable borrowers and underwriters to see how the loan application process is processing. It'll illuminate where things are. I like to think of it like Domino's pizza tracker. You'll know where things are in the stage of approval and where the dollars are after that, including where the borrower is in the repayment process, if there are any issues, delinquencies, et cetera. And it'll ultimately enable better supervision of that process and where things may have gone awry for a particular borrower. As I said, mid-year 2025, no later than quarter 3 2025 is when we anticipate being fully operational with ProLink, that software. Third-party vendor is needed for further operational efficiency, but I believe we're going to be in a much better position to know a lot about our current practices, things that I think we should know today, things that I think I should be able to have at my fingertips today, which we don't, and ProLink will enable. I think it's important for me to note that there are always ways that a program can be improved, and we're going to examine those closely with respect to neighborhood business works. But some really important procedural questions have been raised today, and I look forward to working with the General Assembly to ensure that we are to speak to some of the grant programs and the ways in which we interface with potential borrowers and applicants. We have a really strong relationship with groups like the Small Business Development Centers around the state, organizations like Maryland Capital Enterprise and others to do marketing work. Some other ways in which we do marketing were already addressed. But I also want to share that we have accelerated our Maryland Main Street programming in the last few months. Just last week, we held the first Maryland Main Street conference, and one of the ways that we're marketing our business lending programs is directly through our Maryland Main Street partners. We have 2 grant programs that were launched last year. A second round of one of them that is open right now. We've called that Business Boost. That uses NBW money. So that's a grant using NBW money. It's again, these are micro grants. They're relatively small, $20,000 to $50,000. Ideally, they would complement our lending tools if that was beneficial. We do look at it as a way to open up lines of business, both for the benefit of the businesses and those neighborhoods, like our older main streets, as well as the benefit of the state in terms of the interest payments and revenue to the state. So we intend to continue to geographically target our resources, both loans and grants. To the extent that we do grants, again, these are relatively small by comparison, but I think that targeting will also address some of the challenges that have been discussed here with respect to a business park. A biopharmaceutical company might not be a core applicant to what DHCD does through Neighborhood Business Works. That sounds to me like an outlier. And I'd like us to focus on our core mission, which is revitalizing the main streets, core commercial communities and mixed-use communities that I think are really germane to all of the other programs that DHCD brings to bear and has been entrusted with. So I think you'll see a relatively quick shift back to those core functions. It's already happening. Which was the most recent grant complement to the Business Boost program, only into the Maryland Main Street communities and those core commercial corridors. And again, I think that's where you'll see our work head to the future. So I want to thank the OPEGA team. I want to thank the committee and all the staff for the time that they spent with the reviewers, and happy to continue this conversation and take questions that you have.
Kagan, go ahead.
Thank you, Chair Solomon. Mr. Secretary, thank you for making the time, and thank you for all you're doing at DHCD. The words grants and loans are being used really fluidly here, and businesses and nonprofits are kind of both referenced. I'm wondering if you could, and I don't want to put you on the spot, so I know that Diana and others are going to help us figure out the division of grants versus loan, business and nonprofit. So I don't expect that you have that off the top of your head. But how do you decide who gets the grant versus who gets the loan? Is there a cap on the number? And are nonprofits given greater flexibility in the dealing with the state?
Senator, great questions.
Yeah.
I can answer some of those right now, and the ones that I can't, we will get back to you on. And I don't know that I'll do as good a job as Diana did on retaining all of the questions, but I'll do my best. So with respect to grants and loans, since I've been here, it's been really very clear. The ways in which we have produced grants for application has been programmatically, so not opportunistically. So we've launched two programs, both called Business Boost, with NBW resources. I also mentioned Project Restore. Now that's using ARP money, so that's a federal resource. It's something that we would love to have in statute and continue. But Project Restore 2.0, we call it, because there was an earlier version of that under the Hogan administration. But Project Restore most recently, again, this is the federal program, was made available directly to the Main Street organizations. The intent, the community entity could do a better job than, say, the business necessarily at doing matchmaking and saying, these are the highest priorities for us in terms of filling spaces. Business Boost, the two NBW funded grant programs that we have run, one that's open right now and one we did in the spring, is a limited total amount of resources, so $2 million, so not a huge pool of resources. That's why it's been a small amount of a small cap on funds, so $20,000 to $50,000 is each grant. Again, this is for a really flexible grant purposes. So oftentimes, if a business looks at us for a loan, they're a small business. They're looking for help, and they probably need cash. They probably need operating capital. They might, and we hope, need capital for some real estate pieces, because we want, again, our focus is on the place, the built environment, making opportunities that last beyond even one occupant. That's kind of that's the way we view and the way I view these investments that we're making with state dollars, that these are quick hits, but they can be lasting investments. And so those $20,000 to $50,000 grants have been really flexible, but direct to the businesses. So the businesses are applying to us directly. The ways in which they reach them are through those same Main Street entities, right? And then to put that in context, I think I mentioned what our pipeline looked like as far as loans. So, it's a much greater scale. We've got 10 million in closing, 1 million in underwriting, 20 million awaiting underwriting. So the scale of loans is much, much larger than the relatively small programmatic approach to grants. And as far as nonprofits, that I'll have to get back to you on what that's. I do know we have nonprofit applicants and recipients, but whether or not we are more flexible with them, I'd have to get back to you.
Okay, thank you. Thank you, Mr. Secretary. Thank you, Mr. Chair.
Thank you. Other questions from the committee?
Got a couple.
A question.
Oh, go ahead, Senator. I'll jump in after you.
All right. So thank you to Secretary Day. Good to see you again, and appreciate all the follow-up information there. I think it sounds like you're going to be doing a program to come up with some improvements to your internal processes. I think stemming from that, it would be helpful for us to also kind of look at that and understand if there are things that we can do on the legislative side to put some guardrails in place in statute. Because, while I think, you're coming in with a fresh set of eyes and appreciate your willingness to look at this and to, put some better processes in place within the department, there's no assurance that a future secretary or administration would not necessarily come in and, kind of weigh into the process or tip the scales or, again, have loans go out that have very little documentation attached to them, ballooned by 17 times. And so, I think from a legislative standpoint, there still may need to be an examination of whether additional guardrails need to be put in place just to provide that high-level oversight of this process, similar to what Mr. Powell was saying about emergency procurements, just to ensure that future administrations and successors in your role, have, are able to kind of retain the confidence of the public when it comes to administering this program.
Yeah, Mr. Chairman, I don't disagree at all. I think statutory guardrails are often needed, and there is a role for statute to play in shaping what's possible. And so I think it's a balancing act. So the value of flexibility, of course, is only to remain a relevant lender to the businesses and to be able to be flexible to deliver a product that helps produce the economic and community outcomes that you and I want, but not so much so that there is reputational risk, right? So I think it's completely reasonable that that we look at what those boundaries and what those guardrails are. And if you'll afford us the opportunity to complete an internal audit or an independent audit, excuse me, and to provide the results of that to the Joint Committee and to the General Assembly, I think it will probably shed light on what some of those guardrails ought to be.
Okay, that's helpful. I think, after you've done your kind of independent review, to implement some internal controls, then we can examine whether there's a need for or requirement for additional external controls, I guess, to that extent, right? So welcome the
Yes.
opportunity to continue working with you on this and look forward to hearing about what processes you'll be looking at coming from that audit. Chair Solomon?
Thanks, Chair Lim. Yeah, Mr. Secretary, it's good to see you. Thanks for being here. It was nice to see you in Montgomery County a couple of weeks ago. Appreciate you spending so much time. I just had a couple of things I wanted to touch on, and I would echo Chair Lamb's comments. Very curious to see the internal audit, and I know that we'd all be really excited to be working with you to make sure that those guardrails get in place. Just a couple of things. Would love to just get the commitment, and I know this is, North Star for you and Governor Moore, is making sure that we are truly honoring our MBE commitments. And so just want to make sure that in the data analysis and tracking process that you all are actually holding your grantees and the loan recipients accountable for meeting those goals and updating the information.
If I can react to that first, if that's okay, Mr. Chair.
Yeah, go ahead.
Yeah. Couple of thoughts here. One, I was really proud when I came in, and have been proud to see that DHCD consistently performs well with respect to MBE procurement, small business procurement, and not quite as well on veteran business enterprise procurement, but we come close and sometimes have met our goals. But here's the bottom line on this. The standard by which we are measuring our success, one, is an amalgam of all of our programs. So there are some programs that are working and some that aren't in terms of that MBE commitment and that value statement. So where we're not, yes, I'm interested in us doing better. The other facet of that I think needs a lot of our attention is to recognize that when we put a lot of money out on the street, and the ways in which we are measuring, typically, the ways in which we are measuring that is through a really limited frame. We are not always having a holistic look of our lending and grant making efforts. So when you talk about our housing finance, our business lending, our state revitalization program awards, we want to make sure that those dollars, some of our biggest pools of resources, are having the effect that they ought to have with respect to supporting minority-owned businesses and small businesses and veteran-owned businesses. So I agree with you. It's one of those metrics that we are working on developing internally to ensure that we are not only measuring what we procure in a traditional sense, but also the lending that we do. So you're going to hear us talk a lot about where we're failing and where we're succeeding, I hope, in the years to come.
Great.
On this topic.
Well, and as was said earlier, I mean, you're not accountable for the lack of documentation that was not required during the audit, but just making, I mean, that number in particular is really glaring. The other piece that really stuck out in my head and in reading this report, and I know Mike and his team confirmed this, and would just really like your commitment. There were no NBW grants or loans given out to Montgomery County businesses. I don't usually play the jurisdictional card all that often, but I see some of my colleagues from Montgomery County shaking their head. As the largest jurisdiction in the state, I know we have a ton of priority funding areas and sustainable communities that fit the priorities. And frankly, there's a couple of businesses off the top of my head that we've been working with that I think would benefit from some of these programs, which is really like a commitment that we're going to see more robust outreach. Or maybe there's one of the loans in the pipeline is in Montgomery County, but it would be great to see that number change going forward.
So you have my commitment that's important to me too. I can't explain it. My guess would be that more well-capitalized areas are less likely to pursue a DHCD resource as a lending instrument. But I do think we open that back up through our grant tools and open up those relationships. As I think the chairman said, and as was testified to earlier, this is a relationship business similar to private lending. And so building those connections is important. I will also say, having recently toured some of the Main Street areas, like Tacoma Park in Montgomery County, I am really confident that an increased integration between our Main Street efforts in one part of our organization and our business lending efforts in another part of our organization are going to lead to increased closings and increased lending in those areas. So I've got some ideas too. I think last week in Frederick, some of that matchmaking was on full display, and I hope that it bears fruit in Montgomery County and all over the state. But you have my word that will be a topic that we'll be focused on.
Great. Yeah, I would love to follow up with your team. Maybe we can figure out some outreach efforts that we can all partner with you on. The other piece, I appreciate you mentioning the streamlining. I know we've worked on this with a couple of other agencies. When you all are looking at streamlining, trying to figure out, obviously within the confines of correct underwriting, if there are ways that we can, improve the application process to sort of streamline the timing on that. I know there was an interesting sort of case study and some of the gaps, and obviously some of that is on the grant, the applicant themselves. And would love to work with you more on streamlining the statute around the micro grant piece. Whether we need to sort of take what's in there out, maybe incorporate the programs that you all are doing, because I think for the micro grant piece, it's better as a grant than I think the current system is like a 12% interest rate. And then the last piece that I wanted to just kind of get your opinion on is, the other area that I think this program is really ripe for is childcare. There's a couple of childcare businesses even within Montgomery County that I know had reached out to us for expansions, one in downtown Silver Spring, and they were really one of the only sort of large scale centers that was serving, particularly low income population. And we have some programs that we've been working with Commerce that we created on, but I think this would be a really good fit for some of the larger centers that are looking to build, particularly as they get integrated into other things. So, be curious your thoughts on maybe prioritizing a little bit more. And I know that's a huge priority for the governor, but obviously if we get childcare, we then get the ability to bring in a workforce on a whole host of other things.
1,000% agree. Let me start off though with the your first point. Grants are always better than loans. Everybody needs resources. These small businesses need them desperately. And so anytime that we have a flexible tool to provide grants and the resources entrusted to us to do it, that's wonderful. Grants don't get repaid to us, and we do depend on that to operate the department. A huge portion of our revenue is repaid loans. That pays for our operating. So we have a very negligible impact on the state budget, the state general fund, from an operating standpoint, but that's because our housing loans and our small business loans, that repayment often goes to, or a huge portion of it goes to pay for the department's operations. And so that has some value to the state. Of course, it's a balancing act, right? Of where we want to put a dollar versus whether or not we expect that dollar to be repaid, and the impact we want it to have on the world versus on state operations and state budget. So that's a question, really. I think that's a big philosophical topic that we could dive into, and we can all do that at another time. But I do want to note that there's of course tremendous interest in and value in grant programs. Where we can afford them, I'm 1,000% in support of them. As for targeting resources toward a particular product, I connect this childcare question back to the healthy food financing topic that was brought up in the presentation. I immediately, when I took this job on, one of the first things we did was start to discuss food deserts. And turns out there was a program that had already existed since 2014. This is a near and dear to my heart. I feel like we have the ability as state government to participate, subsidize, instigate the creation of healthy food options in the places where they don't exist for Marylanders. But the economics of it are bad. It is tough to be in the grocery business, especially in the healthy food business. It is tough. And so per project, we have to be in heavy. We have to be in big to make something happen. The same, I think, is true in childcare. It's a costly endeavor. It's expensive. The regulatory processes to protect our kids are cumbersome. The costs are severe. And I do think what we can take from the budget last year that the General Assembly passed and the governor proposed, and what we can take from broadly the child poverty initiatives that the General Assembly and the governor partnered on, like the Enough initiative. All of that is to say that I think we know Maryland's economy is held back in part because of childcare pressures on families. And so where state resources are arriving to pay on the demand side, I think we ought to also show up on the supply or resource side or financing of the establishment of new entities side. And so, of course, we've got to figure out what that mechanism looks like. But I would love to work to design a particular program or tool as a subset of NBW that was focused on childcare, just like and we are trying right now to design a working healthy food financing tool that exists that's targeted. We could leave it up to the marketplace and say, NBW works for whatever, but I think marketing it, as has been discussed here with respect to how do people even know about our programs, marketing it is important. Designing it such that it actually meets the economic demands of that type of business is super important. And so let's continue to talk about this, whether that becomes a program in statute, whether that becomes something that's designed through dialogue. Either way is fine with me, but I think we want to be your partner in getting there.
Great. I really appreciate that. I don't see any other hands. Any last questions from the committee? All right. With that, Secretary Day, thank you so much. Oh, Mike, do you want to jump in? Secretary Day, thank you so much for being here, and to your whole team. I know I see Assistant Secretary Glanz, thank you for being here as well. So I think we are going to move back to Mike and his team for the Department of Labor.
Sure. Thanks, Eric. If you would pull that last presentation up. So last but not least, workforce development. We were asked a year or so ago to take a look at workforce development. And we broke that work into two parts. The first part came out in March. And I will just say, amongst other things that my colleague will talk about in a minute, it is probably the most complete and thorough inventory of the vast array of workforce development programs in the state. And it was designed to be viewed online, and it's got a lot of cool tools to be able to click on links, and it'll take you different places in the report. But I hope it's of value more broadly than just this committee and this hearing. And then part two just came out last week. And with that, Eric, if you go to the second slide, and my colleague, Tori Hall, is hopefully here, and I'm going to hand it over to her.
Thank you, Mike. So we got one request, which is in the top box, which was to inventory all workforce development programs and services in Maryland over fiscal 2018 through 23, looking for areas of overlap, duplication, gaps, or fragmentation, and also to evaluate their efficiency and effectiveness. So as Mike said, we delivered this as two products. The first is really a statewide inventory across all agencies that also offers our observations about areas with gaps, fragmentation, and overlap. The second is about the EARN program, which is a decade-old state-funded workforce development program. And to make an analogy to water bodies, you might say that the part one inventory is like an inch deep and a mile wide. The part two is a deep dive. Next slide, please. As Mike pointed out, a practical point on this inventory, the body of the report is fairly short. It has a long content-rich appendix, really designed to be used digitally. Why? Because we put a lot of external hyperlinks throughout this report to enable readers who want to learn even more about programs that may be of particular interest to you to connect to them. So that would be, for example, agency annual reports, the program's webpage, legislative audits, and so on. And this tiny URL and QR code allow quick navigation. Next slide, please. So workforce development is truly interdisciplinary. Workforce development efforts use many policy strategies. They serve people with very different life circumstances, and they can involve many agencies. Workforce development intersects with education, both in the classroom and on-the-job training. It intersects with social services. It intersects with economic incentives for individuals and for employers, and it intersects with community building. Here's how we defined workforce development for the purposes of this inventory. Publicly funded programs and services designed to build, enhance, or retain a skilled workforce. These could serve job seekers, existing incumbent workers, and or employers, and they could use different policy tools like direct training and coaching, tax credits, loan repayments, or grants. We also had to draw the line somewhere. We excluded economic development programs, and we excluded education and financial aid unless it was for on-the-job training, like apprenticeships, or it is specifically addressed workforce shortages, like in nursing occupations. And using this scope in Maryland, over a dozen state agencies offer workforce development programs. Of course, the Maryland Department of Labor is a major actor here, but also there's the Maryland Department of Commerce, the Department of Health, the Department of Human Services, the Maryland State Department of Education and the community colleges, the correctional agencies, the Veterans Affairs, and so on. Next slide, please. So a quick word here about how we organized this inventory. We did not organize it by budget code or agency. Why not? Because we know you already have an operating budget. We decided instead to organize it by service populations and tools and strategies. And this approach, so I'll give you an example of categories of people. We have a category of programs that serve employers, people with disabilities, incarcerated individuals or formerly incarcerated individuals. Examples of tools would be incentives to encourage training for and filling jobs with workforce shortages. So we hope that this approach would make it easier for you all to find resources that would address specific circumstances or needs, regardless of which agency administers that program. Next slide, please. So federal funds are a main source of public funding for workforce development in Maryland, and those federal grants shape much of what occurs with workforce development planning, the organizational structure of it, how data is collected, and how it's reported in Maryland. And also, a lot of workforce development is delivered at the local level, where the federal funds, which pass through state level agencies, may be braided with other funds, philanthropic funds, for example. Services are often customized for local needs, and it's worth noting that sometimes similar programs may have unique names at the local level. Because of this, we did include a chart in our report that shows how the Workforce Innovation and Opportunity Act, the WIOA grant money, and the Career and Technical Education grant, also called Perkins, flows from the federal level through the state level to the local level. Next slide, please. We did have some observations in our report. An example of a gap is that Maryland lacks the infrastructure necessary to achieve the statutory goal in the blueprint for Maryland's future of having 45% of graduating seniors complete the high school level of a registered apprenticeship or an industry recognized credential by the 2030-31 school year. We also found a gap that Maryland lacks some integrated data and case management systems for workforce development participants. Individuals can, in some cases, are really encouraged to participate in more than one workforce development program in a year, or they may participate in one program over multiple years. And agencies generally don't have the data sharing capability to know this, and we could not identify unique individuals across multiple workforce development programs. Next slide, please. Some areas of overlap that we observed. The Department of Labor provides business services to employers that in some cases can duplicate the business services provided by the local workforce development boards. We identified 4 programs that fund incumbent worker training. The 2 state-funded grant programs, which are the Partnership for Workforce Quality run by Commerce and the EARN program run by Labor, could be consolidated. And we also found programs to encourage training for and filling jobs with workforce shortages. I'm talking here about things like nursing and teaching could be better aligned. Many of these programs are run by the Maryland Higher Education Commission, as well as Department of Health, Labor, and others. Next slide, please. That concludes my comments about the inventory. Pivoting now to our report on the Employment Advancement Right Now grant program. Just to give you a quick overview of this program, it is 100% state funded, which is somewhat unusual in workforce development. It offers competitive grants to strategic industry partnerships of 5 or more employers. Many of these SIPs have many more employers than that. And the grantees then use the funds to train current or potential new employees. So this program is using what's called a sectoral training model that serves both the trainees and the businesses. And the idea is to align the workforce development for the trainees to the needs of the businesses. Over the fiscal year 2018 to 23 period, there's been about $47 million in grants, or $6 to $8 million a year. Next slide, please. This slide gives some summary statistics about these earned grants. There have been, over the period we reviewed, 256 earned grants awarded by the Department of Labor. Participation by employers, more than 1,100 employers and other organizational partners have participated in these. On the individual participant side, about 14,000 individuals have participated in the training, and about 12,700 of those in completed training. And these are based on the final reports to date by the grantees. Next slide, please. This slide gives a quick overview of how these grants have been awarded by industry area. And you can see from the top line that a large proportion of these have been awarded in the cybersecurity information technology industry area. Next slide, please. So going into this evaluation, we already knew that the EARN program is reporting, the grantees report to the Department of Labor, and then Labor reports to the Maryland General Assembly every year, including how many people have gotten trained and whether those trainees were employed at the point they exited training. We were hoping to know more. We wanted to know, can we verify the outcome numbers that have been reported by the trainees? Did the trainee outcomes really persist post-exit? And given that EARN is meant to benefit both trainees and employers, has EARN improved workforce outcomes for the employers that participated? Next slide, please. And what we found was that we really could not answer these questions because of limited program data. So in a way, this report, the end part of our report here, is like a case study in program evaluability. We discuss in our report some of the barriers to that further evaluation, like the limited length of time that records are retained. We could not match the grantee reported employment outcomes against our state unemployment insurance records or other wage records, so that we couldn't verify the grantee reported outcomes, and we couldn't see if they were persisting over time. We also observed that the industry categorizations being used by EARN were unique to this program, and they were not using the standardized NAICS, that's the North American Industry Categorization System, that is used by federal statistical agencies and by some other areas within the Department of Labor. So we couldn't reliably cross-reference workforce data from those sources with this program. And then we laid out what it would take to do more evaluation in the future. Next slide, please. Our report offers a number of options for improving the future ability to evaluate the EARN program and other programs as well. So our report included an evaluability checklist, which is in an appendix, which can be used to more methodically plan, whether for this program or for others, what it takes to do program evaluation later on. We could collect more information about the EARN trainees, which is such as what the WIOA core programs already require for their participants. Now, I want to be clear that EARN is a state program. It does not need to adhere to what WIOA and the U.S. Department of Labor requires for those participants. But in our report, we did do a comparison of what the WIOA already requires to what the labor is collecting about participants for the EARN participants, that you could see what is possible. We also recommended adopting the NAICS categorizations for industries, and suggested adding EARN training to the Maryland longitudinal data system, just as we are starting to do, I believe, as a pilot for some non-credit courses in the. So just to conclude here, we will acknowledge there are pros and cons to what we have suggested. Some pros here are that collecting Social Security numbers or other more detailed information like that could enable verifying the grantee reported outcomes of the EARN trainees against the UI wage records, as I pointed out, are done for many federally funded workforce development programs. Department of Labor could also assess if the grantee reported wage and employment outcomes have been persisting after exit. Some cons are that collecting more data could increase staff costs. In addition, collecting Social Security numbers and other PII can increase the risk that data may be leaked or hacked, and larger reporting burdens for grantees could dissuade some from applying in the first place. And finally, that every dollar spent on data collection and retention is one less dollar available for an EARN grant. So that concludes my comments about these reports. I'll turn it back.
Thanks, and we're happy to take questions, and I believe Secretary Wu is here, and perhaps some others from Labor if there are questions for them.
I see a question from Senator Kagan. Go ahead.
Thank you, Mr. Chair. I don't normally ask this many questions, and I don't want to beat a dead horse. Secretary Wu or Ms. Hall, I don't know whether either of you can speak once again to the division of for-profit versus nonprofit organizations that are getting grants, getting EARN grants. When I look at the list on slide number, not numbered, the service populations include veterans, people on public assistance, people with disabilities, incarcerated individuals. All those folks are well served by nonprofits in our community. So I am curious what sort of opportunities they have. And then the second question, which is probably for Ms. Hall, the 3-year grant record retention, is that required by law? Is that just our practice? And is that something that could be extended? Because that doesn't even cover one term of one governor, let alone the transition to a new administration. So to either of you, and it's nice to see you, Madam Secretary.
I'm happy to start, Senator Kagan. Nice to see you, and thank you to Chair Solomon and Chair Lamb. I'm also joined by 2 colleagues from Department of Labor, Lauren Gilwey, who's our Director of Policy and Workforce Development, and Mary Keller, who oversees our Strategic Initiatives Office, and she has been a leader on the EARN grant. So I look to them to fill in some of this information as well. First, on the retention issue, I don't need to double check with council, but I think 3 years is a little bit of a default, like, record retention level, if I remember correctly. So it may just be that was sort of, what the lawyer said, well, you got to at least do this. And that's how it started. We certainly are not averse to retaining records for longer. Absolutely. And we think having that data overall, it can only benefit us. And we have many grantees who are repeat grantees. And so we have information going back as well. On the for-profit, nonprofit side, I'll maybe ask Mary to chime in too, but I would say, first of all, the structure of EARN is that it has to have 5 industry employers. So by its nature, the partnership is very industry driven. That said, we frequently see employers coming together with service providers. And one of the key things we try to do through EARN is make sure that employers are helping individuals succeed. And that's what they want. They're really looking for talent. So we often see, as part of these strategic industry partnerships, that nonprofit providers are brought into that to provide those supportive services, to maybe work with language access or credit counseling or sort of the many things that people need. But I don't know that we've sort of done a breakout by looking at down the partnerships, like how many nonprofits are engaged. We certainly could do that. Mary, I don't know if you want to provide further color for the senator.
Yes, thank you, Secretary, and thank you, Senator Kagan, for the question. As Secretary Wu mentioned, industry is critical in their involvement with EARN, but each partnership, as I believe Tori mentioned, has to identify a lead applicant, and that is the entity that is actually receiving the funds. And the vast majority of
lead applicants across EARN are nonprofit organizations, community colleges, and local workforce development boards. We very rarely see that an employer wants to take on and lead a partnership. They much rather would prefer to benefit from the workers being trained versus actually leading and, of course, reporting to the department. So the vast majority are nonprofits, community colleges, and local boards.
That's really helpful. Thank you, Ms. Keller. Thank you, Madam Secretary.
Anybody have any more questions for the OPECA team? All right, seeing none, I'm going to turn it over to Secretary Wu, great constituent from District 18. Oh, I'm sorry, Senator Benson, go ahead.
Yes. Thank you all for the presentation. I must tell you that the workforce development in Prince George's County is one of the most important agencies. And that has to do with people who really need hope. And but there is a kind of a disconnect. I need to, at some point in time, sit down to get a closer understanding of how workforce development works here in Prince George's County. And I would ask that somebody call my office so that we can set up a time to talk about it.
Senator Benson, we'd be happy to follow up, and thank you for your longstanding leadership on the workforce front, and of course, your engagement with education, because that is really one of the themes I'm about to talk about is how workforce isn't over here and education is over there. They really need to be hand in glove, especially with many of the ambitious goals set forth in the blueprint. That is a huge part of that vision, is that as we're educating our young people, we're also training them for the jobs of today and tomorrow.
Yeah, the training piece is what I'm concerned
about. Follow up.
And so I need to get a better understanding of what it entails. Because it seems to be a little disconnect between workforce development and our school system, how that works, the agencies within the schools. The communication piece is what's very troubling. So we'll talk about it. Thank you.
Thank you, Senator. Secretary Wu, turning it over to you and your team. Welcome.
Mr. Chairman, can you hear me again? Sorry, I think we lost connectivity here for a minute in the bunker. All right, thank you. Sorry about that.
Go ahead.
All right, I better start speaking quickly if it's okay. Thank you. I want to thank Director Powell and Tori Hall and the entire OPECA team at DLS. For their really thoughtful review of the department's portfolio of programs and all of the workforce system. We really appreciate their coordination, and this is an incredibly valuable resource. I personally found it very useful. So thank you very much for that detailed and wonderful work. I just wanted to respond to a few things. I mean, I would say overall, we concur for the most part with the observations from the program evaluations and a note of the importance of focusing on gaps and duplication. As we're working with the governor and his team, thinking about the upcoming legislation and the new budget, there are some areas that we are very focused on as a department. First, making sure that Maryland is a leader in these emerging and growth industries that are key to our state and where we have a competitive advantage. Healthcare, cybersecurity, biotechnology, clean energy, and infrastructure being some of those key industries. Second, we're really doubling down on registered apprenticeship because that's a strategy that provides pathways to opportunity for a wider group of Marylanders, but also connects to key industries and helps people get those technical skills that we sorely need. And then, of course, just generally tackling barriers to opportunity that helps create more of those pathways, especially for a lot of our youth. And that means addressing things like high school completion, transportation, childcare. There were some key recommendations and observations I wanted to touch on. First of all, I did want to note that I thought it was very insightful to talk about our heavy dependence on federal funding and make the committee aware that we actually have a situation in Maryland now where we experienced a $4.7 million cut in our federal WIOA formula funds, Workforce Innovation and Opportunity Act, in this fiscal year. And the reason for that is the formula funds are based on relative unemployment. And of course, Maryland's unemployment has been at a record low. So it means compared to other states, we got a smaller share of the formula this year from the feds. That will be true next year as well. So it's very concerning because, as was highlighted by the analysts, we're very dependent on those federal funds. I will note also we used ARPA funds, which went to fund a lot of local areas. Those funds are also going to be expiring. So we are in a situation where state investment in workforce is going to be absolutely critical in the coming years. I would say we really want to focus on, as I noted, making greater use of apprenticeship, including for youth. And I would say it's sort of investing more, but also investing smarter. So we need to, we have some funds that have already been noted by the General Assembly in a dedicated purpose account to invest in apprenticeship. We have to make the best use of those possible and really work with the ambitious goals that were set in the blueprint that the 2030 Commission is setting forth to make sure that we are achieving as much as we can. There was also an observation there's maybe some duplication in business services. And actually, we have decided to shift a bunch of staff who are doing business services at the state level and really focus on business outreach around apprenticeship and growing the model in non-traditional sectors. So that's a move we've already taken as a department since these findings in the spring. We do want to also focus on reducing duplication and leveraging existing resources. And that is not just, we often think about Department of Commerce, Department of Labor, Economic Development and Workforce Training, or higher education. Absolutely need to make sure we're using those resources. But at the department, we've been very focused on working with MDOT. We have a big partnership that we're about to announce on that front, as well as healthcare, clean energy. We need to use all of those resources that we're saying we need more clean energy. Well, we need workers to install those solar panels, right? We need better healthcare. Well, we need workers to be trained in those skilled nursing and technical areas or biomanufacturing. In order to grow that, we need to have the skilled workforce. So thinking about how we're always making sure every conversation about growth is also a workforce conversation, and we're investing in Marylanders to get those skills. And then I want to pivot to talking about EARN a little more specifically, because I thought the deep dive was incredibly helpful. As was noted, EARN is an industry partnership and it's very successful. We often get held up by our federal neighbors talking about what a wonderful and leading program this is. But the fact is, our demand far outstrips our ability to fund programs. We routinely get many more applications than we can support. We support many of the observations raised about getting greater fidelity in the data collection. I do have some hesitation about using WIOA as the benchmark. I want to say the personal records fields, I think there's 70 fields or something like that we have to report on for the federal grants. That's just not something that a lot of employers, especially smaller employers, are going to want to manage. And even though nonprofits manage it, asking that many questions about your workforce, a lot of smaller companies are just not going to feel comfortable providing that level of information. So I think, we can find a balance, certainly thinking about how we can leverage the UI data or use social security numbers while safeguarding privacy and not creating burdens for these smaller nonprofits or employers, because it's not a large program. But absolutely, we want to continue to evaluate and see what we're doing better. And we also are thinking sort of, again, as I said, in transportation or infrastructure investments, how can we take the best learnings from EARN? So really focusing on being innovative with some of our supportive services so we can do more. I do want to express gratitude to the General Assembly for supporting the Talent Innovation Funding Program last year, because we recognize that also would enable us to leverage, for example, philanthropic investments or corporate investments to make state dollars go further. And we actually are in the midst of reviewing grant applications for cyber range pilots at the community colleges across the state as part of that program. And we plan to announce the winners later this year. So I just want to thank the Assembly and and all of the members who are here on this call for their support of those issues. And in closing, I just want to thank OPEGA and the committee for this, really thorough analysis. It was really helpful. Happy to answer further questions or go into greater detail.
Any questions from committee members? I had two quick ones, and then I'll turn it over to Chair Lamb. Secretary Wu, thank you again. First question: I know there's been a lot of talk nationwide about sort of how do you integrate things better and track. Are there any state models that you would recommend? And Mike, feel free to jump in here as well, that you think Maryland should be looking at, or sort of maybe a bunch of different states that we can pull things from to integrate our system a little bit better. And obviously, as you said, EARN, I know has really been a national model.
I do think, we've done a great job on sort of some of the sector and industry apprenticeship partnership work. And even in apprenticeship, Maryland's long been a leader, but I think a lot of other states are moving ahead. Some places like Wisconsin, I think, are doing a lot on youth apprenticeship. South Carolina probably has some very interesting combinations of strategic industry partnerships and apprenticeship. Where we probably need to do more work, and I know Secretary Rye is very interested in this and is thinking about it, is how do we better integrate our higher education investments? And that was highlighted in the OPEGA analysis, because we spend, and this is true nationally, you'll spend 10 times more on the community college side than we will on the straight workforce grant side. So we really need to make those structural changes. I'd say, Texas does a lot with data and understanding how the feedback loop, MLDS was really, the longitudinal data system was really a leader in its time. We are probably, and I'm chair of the governing board now, so I think about this a lot. We're probably overdue for a refresh and relook at the investments to make sure that we have kind of much faster real-time data feedback loops on the higher ed side. I mean, with the Promise Scholarship now covering non-credit, that is huge. That is a potential game changer. But we really need to understand, what are we getting out of those investments? And I know Secretary Rye is looking at, certificate completion as well as degrees. What's happening with performance? Because Maryland has a more diffuse and localized community college constellation, that can take a little extra work. I would say also, there are places like Massachusetts and life sciences where they've done a great job on really thinking about how do you have an ecosystem together. It's not workforce, higher ed, industry. It's how are we really making those incentives align? And I know I hear from Senator Hester often on that, on cybersecurity, like how can we do that in cyber? Would love to, and we're trying some innovative things there, or poised to, but would love to do that in some other sectors. And obviously, biotech and life sciences seems like a perfect opportunity to think about that as well.
Thank you. Yeah, actually, you touched on what my second question was going to be. One of the things that I've heard frequently, and Delegate Smith and I did a couple of tours of apprenticeship programs, more on sort of the building trade side of it, but it was something that we talked a little bit about when we opened the Promise program up, and couldn't really quite figure out how to make it work, but would be curious your opinion on this. So it's one thing if you have a certificate program, but in an apprenticeship program, what we heard a lot, particularly again on the building trade side, was, you have folks who, particularly low-income students, that are not necessarily able to pay for their transportation. They're not able to pay for the initial materials or the tools that go with it. And so obviously we have limited resources, but would be curious your thoughts on how we can open up, what we could tweak. Maybe we could create some sort of a fund that would allow, even if it was like a loan that got repaid later, especially if they're in an apprenticeship program that is paying them, but to make sure on the front end that the cost of entering the program and the materials that go with it are not a barrier for students to be able to get into it.
And that's absolutely an issue. And I've seen in other contexts, people do sort of like a last mile, like micro scholarship type of thing, where like we're not going to ask, what do you need this up to $500 for? Or maybe it's bus fare, or maybe it's groceries, or maybe your device broke, or you don't have work appropriate clothes. Like it could be any of those things. I absolutely think there's a need there. And we, for example, in EARN, we're fairly flexible as long as people sort of explain why certain kinds of support services might be needed. debt counseling, those kinds of issues, housing. We often find that people need help with a lot of these different aspects of their life to be able to be work ready and work successful. And the partnership I mentioned that we're working on with MDOT, and this is actually funded by federal dollars. We have explicitly gone back and forth to understand, can we be more aggressive in piloting some innovative approaches on supportive services? Because you're absolutely right. The thing I will note is longer and more technical trainings, and you saw this in the earned data on cyber, and this is true on healthcare, as well as more supportive services get more expensive per head. The investment's absolutely worth it, I think. And as we're looking at earn, we're talking about how can we're doing a great job of getting a lot of people into entry-level jobs or skilling up people who are in existing jobs. Can we help people go from like the first rung to the second and third rungs more, especially in places like healthcare or IT? I think that's something we'd really like to focus on, but it does start getting more expensive per head.
Yeah, I'd love to talk to you and your team about that. I know obviously money is tight, but if we could figure out a way to make that work, I'd love to think creatively with you on that. Thank you. I don't see any other questions. Going once, Senator Lamb.
Nope, no further questions from me. Thank you.
To the chairs and all other members of the committee, I would say we're happy to follow up. One thing we realized we could do a better job is making sure you know what grants are happening in your district, maybe giving you a heads up. I do think it's earned, but other workforce programs, they make such a huge difference in people's lives. And, you know, the services we're providing at Department of Labor, because we have not only these workforce grants, we have adult education, we have correctional education. We want to make sure that you know what's happening in your district and have the opportunity to connect with some of those local providers and lift up some of those success stories because they can be really powerful. So please let us know. Andrew Fulgeniti obviously is our Ledge Director. We're happy to provide you whatever you need in terms of follow-up.
Thank you. Thanks, Secretary Wood. Thank you to your whole team for being here.
Thank you.
Senator Lamb, any closing remarks?
No, I think we've reached the end of our agenda. We covered a lot of very diverse topics and programs within the state, and certainly appreciate all the effort and work by Mr. Powell and his team at OPEGA. And just wanted to thank the committee members for their time to join us this morning.
Same here. Thank you to the whole team for these really thoughtful and thorough reports.
Thank you.